What are the things that you recommend people monitor when they take growth hormone?
Yeah, so the main thing is going to be your insulin resistance. What's going to raise your blood sugars. That's what the main issue with that is. So there's some things you can do because people also eat a lot of carbs while they're taking growth hormone, right? So like that
I
doesn't
was going
help.
to ask
That
you,
doesn't help
how
the
much of
issue.
it is the carbs, or how much is it? Can you even tell how much is the growth hormone versus
Yeah,
the carbs?
it's definitely an acute thing with growth hormone. Like if an athlete takes growth hormone right before bed, like you will have an elevated fasting glucose because it directly triggers like lipolysis, right? And the fat is getting converted into glucose and it's in your bloodstream. So you're going to have more glucose in your bloodstream. I think some things that people do is just immediately upon waking, do some fasted cardio before you eat, get your blood sugars back down. A lot of people will take insulin as needed. That's not a lot of people. A certain population will take insulin exogenously as well if it gets out of control. But ideally, you can manage it without taking exogenous insulin. That would be just what you see is like it's dose dependent too. If you can generally see muscle building effects after 4 IUs, right? So if you're looking at taking GH for like longevity, usually it's like 1 to 2 IUs, right? And then if you're trying to now take it for muscle growth, usually you have to get into like the 4 to 6 range. And usually in that 4 range, some people will see insulin resistance, some people will be fine. Now people are taking 8, 10, 12. Then you're probably going to start seeing that insulin resistance for sure. Along with other weird things like your hands will go numb and just from like extra water retention, I guess. Because I've seen people start taking growth hormone literally within a week, they're up 8 pounds just from like water retention. So it can kind of cause some hand numbness and things like
Carpal
that
tunnel,
too.
maybe.
Yeah, carpal tunnel. So those are some other things to watch out for. But as far as like the insulin resistance specifically, one is dose dependent. Not everyone deals with it, but if you're starting to deal with it, then you have to adjust based on taking berberine or metformin as some sort of way to control it somewhat. When we get into those higher ranges for people from 10, 12 IUs, then you probably have to start taking at that point some exogenous insulin to control that. There's the difference where some people will just take like Lantus or one of the longer acting ones as like a baseline prophylactic, and then other people will do like the shorter acting between meals, like as needed to get your blood sugars back into check.
I just don't know how great of an idea that is, because what you're really trying to decrease is insulin, right? So the reason that you get insulin resistance is because you have too much insulin circulating in your system and your body kind of gets used to it. It adapts to it. And that's actually the problem. So adding exogenous insulin, it would lower your blood glucose, but I'm not sure if you necessarily even need to do that. So I would highly recommend in that case, whoever can get their hands on like Jardiance or empagliflozin, use that, because that works. It decreases your glucose by just having you urinate out glucose. Like you don't actually increase your insulin and decrease your glucose. You're shuttling it out of there, which is actually what you really want.
Right.
I think you're probably okay if your blood sugar is hanging out at like 150, 160. You don't want it to go like 2, 3, 400. Then it's going to be problematic. I'm not sure. I'd have to think through that more. I think then you also want medication. So there's a medication called pioglitazone. That is one of the best diabetic medications for increasing your insulin sensitivity. I think that's something that people could consider and look into. Obviously, work with a doctor to
How
make
does
sure.
it work? What are like the mechanisms of it?
Man, this one is like crazy complicated. So essentially, it helps increase the insulin sensitivity in your liver and your muscles, which is like where most of where your glucose is going to get stored. How exactly it does it? I don't remember off the top of my head. I can look in a second. Glitazone improve insulin sensitivity.
So I think another benefit of taking exogenous insulin would be it also has like an anabolic effect, right? Like if you were training hard and then you eat a lot of carbs and your blood sugar is high, and then if you take exogenous insulin, it'll help shuttle all of the nutrients into your muscle. Is that a correct thought process?
Well, yes, but I think in this situation, you already have a lot of that happening with the IGF, right? That's why the anabolic effects of the IGF, like causing more insulin to be released, is. I guess I'm wondering. I don't know how much incremental anabolic effect you get from the extra insulin, right? Because you wouldn't be using that extra insulin if you didn't have the IGF causing insulin resistance in this scenario. Is that right?
Well, not necessarily, because let's say you're eating 800 grams of carbs a day, then your blood sugars could be elevated regardless, right?
Sure. Yeah. 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 It's a good question. I guess like thinking through this, I would lean on the biomarkers to help sort this out. You mentioned here that when people take growth hormone, they notice the insulin resistance. Like, what are they checking typically to diagnose that?
Just like the blood sugars, usually just like
Okay. And
at
just
home
like,
finger prick.
okay. Do finger stick. Okay. Do people use continuous glucose monitors? Is this like a thing in the
That's not
bodybuilding
super
community?
common.
Okay. I think that could be interesting too, because that would help you figure out which meals and which combination of like meals and activity are lowering your glucose better. I would highly recommend people get a fasting insulin blood work done. So there's a measure called a HOMA-IR. It's like homeostatic measure of insulin resistance. It's a really simple equation. It just takes your fasting glucose and your fasting insulin, and it can help you figure out how much insulin resistance you have, because glucose is not the whole story here. It depends a little bit on your insulin as well. There's also some more advanced tests. There's one called like LPIR. It's like lipoprotein insulin resistance. It's actually one of the earliest detections of insulin resistance. It's a blood test you can get at like Quest, LabCorp. I would look at that to tell first if you're getting insulin resistance. It's probably okay to diagnose it based on your blood glucose. If you're just eating a bunch of carbs, you're right, your glucose is going to go up. And then IGF-1, that could cause it too. So yeah, I think I would monitor it from that standpoint to tell how much of this is just like you're eating more carbs and how much of this is like actual resistance to insulin in your system. Just so you know, I quickly looked up that pioglitazone. It's something called like PPAR gamma agonist, which you actually referenced this in, I forget what it was. We were just talking about this. Something increases PPAR, another compound. Yes, Tobasartan. So it works in a similar way, and it directly reduces the resistance to insulin, which is what you want in these situations, both in your muscles and your liver. So I somehow remember that.
And it's also something that Retatrutide and Tirzepatide can also do, right?
Yeah, totally. It's not entirely clear how they do that. I mean, your GLP-1 agonist, GIP agonist, and then Retatrutide adds on. Although I wanted to ask you, I know folks in the bodybuilding community use these. Is there an issue with like you're just like it's even less hungry, right? And now it's like even harder to keep up with the caloric demands because you just don't want to eat, or even like some of the GI effects, right? Where it's like you start getting nauseous if you eat too much.
I think
is that an issue?
Yes, I think in the off season when you're actually trying to build muscle and eat a lot of food, what some people are doing with Retatrutide is taking it at a very low dose. I believe the clinical trials were starting at like 2 milligrams a week, and they tapered up to like 12, right? Whereas with bodybuilders, what we're seeing is like those keep it at like 1 milligram a week and just run that through their off season. It helps with like the A1C, and it helps with your LDL. It doesn't have as much of a suppression of their appetite and the nausea and slow gastric emptying and things like that. That's like the off-season protocol for it. But then in competition prep is where you're going to see it like really shine, right? Because it can help with accelerating fat loss and keeping insulin sensitivity high and suppressing your appetite, which is a great thing when you're
not trying to eat then, right? You're
not trying to eat a lot, and it helps with the hunger and stuff too. So that's where it like really shines for sure. But even in the off season, people are seeing it have really good effects with like their A1C and cholesterol.
Got it. Yep, that makes sense. And I mean, during that cutting phase is also it would be a great time to have a continuous glucose monitor to sort of see where your glucose levels are at. I know you mentioned your Aura Ring and how it helps you identify your stress. I don't know how useful it is to know that in the cutting phase, but your blood sugar levels when you wake up are also an indicator of how stressed you are, because it's kind of like how much cortisol is in your system. That's going to drive that.
I didn't know that.
I think HRV is probably a better measure, but it's just like another data point that can help you triangulate that. I'm glad you mentioned the Retatrutide and Tirzepatide. That makes a ton of sense. And generally speaking, again, like everything, you guys are going through cycles. Having a little bit of insulin resistance during that bulking phase is probably not the worst thing in the world. I definitely would try to like measure it later and make sure it's coming back down. But yeah, I gotta get you on this LPIR test. You will love it. It is like the best for insulin resistance. It's not the cheapest in the world. It's probably like $30, $40, but it looks at the relative sizes of your different cholesterol molecules. So it's like how many small...
I had that done actually.
You have?
Yeah.
Okay.
Yeah,
So this is the
with
earliest
function,
indicator. Function has that. Okay, maybe it's an add-on at function. I can't recall.
where it's like the small particles, the medium, the large, and like
How many
the
of your LDL particles, small, medium, large, same with like
yeah.
triglycerides? Because essentially early on, as you're getting more energy, your body's starting to shuffle around like the mix of those different molecules, because that's how it's storing the energy is in these cholesterol
Yeah.
molecules.
Yeah, I think I had a bad distribution, like the one that's worse
Well,
for
it's the most sensitive. So like
plaque
that is
buildup.
the first indicator that you're getting insulin resistant. Like before you see your A1C change or anything like that, that's going to be like step one. So it's actually very useful if you think somebody has very little insulin resistance and you want to detect it super early.